afternoon, my name is Madeline Albanese. Today I'm going to be performing manual muscle testing on you. I'm going to test your hip flexor. So I'm going to have the patient sitting off the table with the knees bent and the feet dangling. Is it okay if I go ahead and put my hands on your hip? Yep. Okay, perfect. So I'm going to use my right hand and stabilize the proximal femur. And then I'm going to instruct the patient to lift your knee to the ceiling for me. Perfect. I'm going to use my other hand to test the rectus femoris and the iliopsoas group. You can go ahead and relax. And that was a 5. I would test bilaterally for any injuries or complications. We're gonna be moving on to range of motion testing. My patient is going to be prone with her feet dangling off the table. I'm gonna cue you to relax your foot for me. And then I'm gonna use the stationary arm of the goniometer to bisect the tibia. I'm gonna go ahead and wrap my hand around the talus, stabilizing it. And then to test for calcaneal inversion, I'm going to wrap the moving arm of the goniometer around the calcaneus. And then while stabilizing the talus, I'm going to invert the calcaneus. And today her reading's around 20 degrees, which is within the normal range of motion, which is 0 to 20 degrees. And I would test bilaterally. Moving on to special tests, we're going to be testing anatomical leg length discrepancy. So I've marked my patient at the great trochanter and the knee center between the tibial plateau and the medial and lateral condyles of the femur. My patient's going to be lying supine, and I'm going to go ahead and take the first measurement from the great trochanter to the knee center, which is 17, and then from the medial knee center to the medial malleolus is 15 3/4. I would add them together and then test bilaterally.